Now, I'll quickly try to look at the next drug here, and this drug is known as bevacizumab. Okay, bevacizumab. Okay, so it has a lot of brand name. Popularly, you can see Cizumab out there. You can also see Avastin. Yeah, I usually bring the most popular ones that you can actually see. So bevacizumab, we say that it's a recombinant humanized monoclonal antibody. It targets the vascular endothelial growth factor A. Okay, so you should know that vascular endothelial growth factor is a very important stuff or factor in trying to make sure that cancers get sufficient blood supply. It's just like you have terrorists in a region, you have armies trying to block roads that gets to these terrorists, but you have someone that is trying to bypass resources so that it reaches these terrorists. That's what this vascular endothelial growth factor does. It is making sure that the cancer cells in your body, they are receiving so much special blood supply. So if you're able to block this terrorist supply chain, you are able to kill the terrorist. If cancer cells don't get sufficient blood, they always need more blood than the normal body cells because they are evil, they are growing so fast. So to bind this vascular endothelial growth factor, it will now prevent it from even interacting with the receptors. It will now inhibit new blood vessel formation. If a normal a normal body cell is having about uh, 10 like let me say blood supply to it, a cancer cell will have like 30. Okay, so it will inhibit new blood growth. So the cancer cell is not having sufficient blood, so it's protesting. The oxygen and nutrients are not really reaching it so much because it grew faster. Okay, so to slow tumor growth and progression, it will reduce abnormal blood formation. So pharmacokinetics, I'll give it through the veins. Okay, intravascular, or if it is something that has to do with the eye, I'll give it intravitreal. So distribution is confined to the vascular and the endothelial compartments. Metabolism is proteolytic. Elimination half-life is about 20 days. So I use it to treating cancer. So oncology, cancer of the rectum, cancer of the colon, cancer of the lungs, cancer of the kidney, glioblastomas, cancers of the ovaries. I use this drug to clear it. Also in the eye, all those diabetic retinopathy, retinal vein occlusion, I use it to clear it. Okay, so I think this is the beautiful pharmacology behind bevacizumab.